This question comes from John in Maslin, Ohio. How will budget cuts impact funding for cancer research and screening programs in my community? John, that's a really good question. First of all, if we cut the cancer funding budget, cancer research budget, that research that has gone on and been funded for many years doesn't get completed, and we don't get the benefit out of it. For instance, in your state of Ohio, the NIH funds research to the tune of $800 million this past year, and that's going on in any number of universities and clinics and research centers around the state. For instance, Ohio State University, the University of Cincinnati, the Cleveland Clinic, just to name a few. So there's a lot of work going on, and there are a lot of people focused on this, and it's important when you're trying to discover something that we don't currently know the answer to. So that's something that we need to keep going. Had we had a 5% budget cut for fiscal year 2011, a lot of things would have happened. And let me give you just a few examples. We would have phase 3 clinical trials for cancer patients that would be canceled. The lack of the continuation of the research that I just mentioned. There's a big study going on the impact of CT scans for pediatric patients. That wouldn't continue. So there's a big impact. And it gets even worse because that was fiscal year 2011, and with your help we prevented those cuts from occurring. Now we're facing cuts that have been proposed in the House budget for 2012, not at a 5% level, but at a 13.5% level. I should also say that in fiscal year 11 and again for fiscal year 12, there are even more dramatic cuts that are being suggested for the CDC, particularly for their cancer screening programs, like their cervical and breast screening programs. If you cut them further, what happens is about an additional 40,000 women wouldn't get screened. The cuts again for 2012 are even bigger, so even more people wouldn't get screened. John, I really want to thank you for asking this question. And again, you're asking a really good question that a lot of other people asked. We just selected your question, but I want to thank you for thoughtfully asking the question, and we are delighted to be able to try to answer it.